and recognize the prime sponsor, Senator Gray.
Thank you, Mr. Chairman. My name is James Gray. I represent Senate District 6, which is Alton, Barnstead, Gilmanton, Farmington, New Durham, and Rochester. This bill, Senate Bill 459, is the result of months of work. Most of what actually came to this language has been in the past year, but this has roots that go back many, many years, and to an incident in the state hospital where one of my constituents was injured and out of work for an extended period of time due to that injury. The things that we did in the state hospital were successful in helping. So now we're trying to take this and expand it. Completely different issues in the other hospitals than we had in the state hospitals. So many of the people that you will hear speak after me will talk to the various things. Certainly we started out with people who wanted to expand the penalties for injuring someone in a healthcare setting. What you have in front of you is heavy on trying to de-escalate the situation and then using that information that you would gain during that de-escalation process to be able to effect an arrest of a person that you just can't deal with or is causing injury. And with that, I'll defer most of the questions to the people behind me, and I'll be happy to try and answer it.
Any questions of Senator Gray? Okey-doke. Seeing none, thank you. And we'll recognize Senator Rosenwald.
Thank you, and good morning, Mr. Chairman. For the record, I'm Cindy Rosenwald from Senate District 13, and I was a member of the committee that examined safety in healthcare workplaces, and I just want to add my voice to supporting this bill. And I also want to commend Senator Gray for steering the committee carefully to avoid criminalizing mental illness while being able to work to improve the safety of healthcare workers. The language in the bill, I believe, threads the needle beautifully. As he said, months of collaboration among a wide variety of stakeholders. And the data piece comes from a work group that Senator Sherman led over a number of months and will be critical to our understanding of why violence is rising in healthcare settings and how we can work to reduce it. I had an email a few minutes ago from Holly Stevens at NAMI. She's traveling from out of state, probably won't get here, but asked me to let you know that NAMI is neutral. And they participated in all of it, so they've taken no position on the bill. But I hope that you'll just look at it and go forward with it. Thank you.
Great. Questions of Senator Rosenwald? Seeing none. Thank you very much. Paula Minahan and Chris Herring, Foundation for Healthy Communities. Good morning.
Good morning. Can I take your test? So I have 3 sets of testimonies. Let me do it this way. Try to be efficient. Good morning, Mr. Chairman, members of the committee. For the record, Paula Minahan, Senior Vice President, State Government Relations for the New Hampshire Hospital Association, representing all our hospitals. And here with me today is Chris Herring, our Vice President of Quality Improvement with the Foundations for Healthy Communities, which is an affiliate of the association. And I'm going to make my comments pretty brief and just outline the sections of the bill, because there are quite a few sections that I think are worthy of comment, and then I'm going to ask Chris to really talk about the importance of why this bill is so important and how it's kind of connected to the Quality Commission that I think some of you are well aware of. So I do want to thank Senator Gray for sponsoring this, as well as all the co-sponsors, including Senator Sherman and Senators Rosenwald. This bill is the result of Senate Bill 100 that was passed last year, which did establish the committee to study workplace safety in healthcare settings. This legislation is extremely important due to the growing incidences of violence in healthcare settings and the need to protect our healthcare workforce. And as Senator Gray said, and Senator Rosenwald, he was the chair of the committee, and Senator Rosenwald was also on the committee, along with Representatives McMahon, Green, and Litchfield. Senator Sherman was very engaged in this study committee, and I need to shout out a big thank you to him, because he did attend most of our meetings and was extremely important in the development of the legislation before you today. In addition to all those meetings that we had, he also, Senator Sherman, pulled together several work sessions to develop the workplace violence prevention program, as well as changes to the arrest without a warrant statute. And I know John Patty from CMC is here today, and he oversees security along with a number of other areas within CMC, and he will be speaking as well. In addition to the testimony that I handed out for myself, for Chris, who will speak in a minute, I also handed out Lieutenant Frank Harris's testimony. He was unable to be here today. I think some of you know him. He's a unit commander for the New Hampshire State Police at the state complex, and he works at New Hampshire Hospital. And his testimony, I think, I won't read it, but I wanted to indicate that it was being submitted for the record, because I think he's been very involved in all of these discussions as well, and has been a law enforcement officer for 33 years, and has had a lot of experience with this issue. There are 4 sections of the bill, and I will outline them real quickly, because it's a big bill. And then I will ask Chris to speak. So Section 1 of the bill establishes the prevention program. The program initially focuses on hospitals and urgent care centers, because through the study committee and work sessions, it was determined that those are the facilities that have the higher risk of violence against healthcare workers. Each facility will be responsible for implementing and maintaining a workplace prevention program. And then the requirements of the program are outlined in the legislation. We did receive a significant input from New Hampshire Nurses Association representatives, who I believe are here today and can provide more detail on why this is important. And I do appreciate their help, because it was their involvement was significant. Section 2 of the bill establishes the New Hampshire Healthcare Workplace Safety Commission, which we are very excited about. This commission is modeled after the New Hampshire Healthcare Quality and Safety Commission, which has been in place for over a decade. Chris is here today to explain the difference between the two commissions. Section 3 renames the aforementioned commission, and we add patient to the title before safety, so now it'll be the Patient Safety Commission to distinguish the two commissions, because their names are similar. But workplace safety is the one we're establishing with this legislation. Section 4 changes the warrantless arrest statute to ensure that law enforcement can properly respond to violent incidences in the healthcare setting. And again, between Lieutenant Harris and John Patty, I think they can answer any questions relative to that. And thank you very much, and I'll turn it over to Chris.
Good morning, Mr. Chairman and members of the committee. My name is Chris Herring, Vice President of Quality Improvement at the Foundation for Healthy Communities, and I'm also the administrator for the New Hampshire Healthcare Quality and Safety Commission. I'm here to provide background on the role and structure of the New Hampshire Healthcare Quality and Safety Commission, and to explain why establishing a similar entity to examine healthcare workplace violence is imperative. The New Hampshire Healthcare Quality and Safety Commission was originally established in 2005 by the New Hampshire General Court to provide a confidential forum for quality professionals from all New Hampshire hospitals and ambulatory surgery centers to share information on adverse patient care events and to learn how to prevent them. For the past 17 years, Commission members have enjoyed the opportunity to look beyond their organization's experiences and data into statewide data, to identify patient safety trends, and to share frankly with their colleagues. The ability has resulted in substantial learning for all participants and a much more proactive approach by each organization to reduce preventable harm. In 2015, hospitals unfortunately started seeing an increase of violent acts against healthcare workers, and the Quality Commission became the de facto entity to discuss these, as no other forum existed. Hospital safety officers have been invited into commission meetings to present on workplace safety events and to share their recommendations and policies to make hospital workplaces safer. Commission members who often do not have primary responsibility for their hospital safety programs have in turn shared these recommendations and resources with their safety officers, emergency management coordinators, and senior executives. The Commission has urged hospitals to collect workplace safety data, but unlike the mandatory reporting requirement of adverse events by the New Hampshire Department of Health and Human Services, there is no mandatory reporting required for workplace violence events. Currently, workplace violence data is incomplete and lacking standardization. Unfortunately, violent acts against healthcare workers in hospitals continue to increase in number and severity. Continuing to have these events reported via the Quality Commission is suboptimal for the reasons that the Commission's focus is on patient safety and not workplace safety. Quality professionals are typically not in charge of hospital safety programs and the ones who can affect change in these programs. Ambulatory surgery centers are not experiencing similar violence, so much of this discussion is not germane to them. And other healthcare entities who are experiencing increasing workplace violence, such as urgent care centers, are not represented. Because the structure of the New Hampshire Quality and Safety Commission has been so successful in allowing hospitals and ASCs to improve patient care and patient safety, it makes sense to replicate this same structure to create a commission specifically focused on health care workplace violence prevention. This new commission, coupled with a robust reporting requirement for workplace violence events, will provide the forum necessary for hospitals and other healthcare entities experiencing workplace violence to make positive change. Thank you very much.
Thank you. Are there any questions? Seeing none. Thank you both. Yeah, yep. Thank you.
Paula and Chris, you know, I wanted to add something to this on the reporting side, and I think there was some pushback. So rather than waiting for an exec session, I'll ask you, and I think Senator Gray is aware of this, there was a place, page 2, line 36 to 37, possibly? Right. Section F. I wanted to expand the reporting, and the reason for that is there was a strong interest on the part of the Disability Rights Center, NAMI New Hampshire, and the ACLU to be sure that we knew which of these incidents involved patients with behavioral health concerns, disability, or mental illness. And so what I was looking for was to have that line expanded. If the incident involves a patient, the report will include their diagnosis, condition at the time of the incident, any resulting injury or impact, and their role in the incident. The patient's name and other similar identifier shall not be included in the report. And I think some of the pushback from Paula was that condition is hard to have. What I was trying to get at was the patient psychotic? Were they in other words, were they competent? And this was really getting at sort of the meat of what we were talking about with ACLU and Disability Rights Center and others. And when I mentioned this to Paula, she had mentioned that there was some pushback, and the diagnosis is fairly simple. That's just a code. But I'm wondering if we can somehow incorporate that. Would you be amenable to incorporating that into the reporting in some form so that we can get enough information to be able to address the concerns of the ACLU and others that we are not principally dealing with people with mental illness or disability?
So, Senator, thank you. My concern with the diagnosis is that sometimes the primary diagnosis might not reflect that the patient also has a behavioral health condition.
Right.
So while that is valuable, I think, to collect, maybe additional question about is there behavioral health condition present also might be important. So,
follow-up? So if we had diagnosis, which would presumably be primary diagnosis, but you know the coders are really great at listing every single thing down to a pimple that might be going wrong with a patient. Just it sort of tweaks the reimbursement, I think. But if we had a subsequent question on the actual survey or on the reporting form that said was mental health, was there a behavioral health issue or a disability, would you all be okay with that as an additional reporting line?
I believe so. If it's not too specific, I'm just trying,
Right.
I think that's actually our challenge, is trying to figure out, because we have to still, implement this with our hospitals. So I'm just trying to make sure that we can, it's easily, that we're not burdening them. But I think that idea to indicate it somehow makes sense.
Okay.
Yeah, just not making it specific
I'll
down
do
to the
some word-
ICD-9 code or something
Right.
like that.
I'll do some wordsmithing.
Okay,
Thank you.
great.
Senator Gray.
When I look at page 4 of the bill where it talks about the duties of the commission, certainly I did receive the communication from Senator Sherman before I sent the bill into the final draft. And when I looked at page 4, talking about I see in several places it says the committee, shall include but not limited to.
Right.
And, certainly Senator Sherman may be correct that, that should be added, but I'm certainly willing to let the committee make those decisions, because it does give them the right to ask for, would you agree or disagree?
I'm okay with not adding that back in.
Okay, we're starting to,
Exactly. Yeah, I know.
all right. Are there any further questions of the witnesses? Very good. Thank you very much.
Thank you.
Mr. Patty. It's probably Dr. Patty. I apologize.
Officer.
Thank you. Good morning, Mr. Chairman and senators of the committee. Thank you for taking the time to consider this important legislation. My name is John Patty. I'm the Executive Director of Support Services at Catholic Medical Center. I'm also a retired sergeant from the Manchester Police Department. I would like to begin by thanking everyone who was involved in the bipartisan process of developing the language in the bill that you have in front of you. I very much appreciate their patience and input. Those involved include Senators Gray, Rosenwald, Sherman, Representatives Green, McMahon, and Litchfield. We also received helpful input from the ACLU, NAMI, the DRC, New Hampshire Attorney General's Office, New Hampshire Chiefs of the Police Association, Paula Minahan and the New Hampshire Hospital Association, and hospital staff members throughout the state. When I was hired as the Director of Security at CMC, I was astonished at the behavior of some of the patients and what the clinical staff endure. I often tell the clinical staff that they don't have to tolerate incivility or criminal behavior, and try to compare that behavior to other situations such as being out in public or at restaurants. If someone was treating them that way, they wouldn't stand for it. And just because the patient is within the four walls of our facility doesn't mean that they are allowed to behave without consequence. If you're not aware, assaults and workplace violence in healthcare facilities has been an increasing concern for healthcare workers. Depending on what publication you read, the stats indicate that healthcare workers are 4 to 5 times more likely than other private industry employees to be the victim of workplace violence. There are many studies, including some from OSHA, that show the prevalence of assaults in these settings. Part of the work that went into this bill focused on the need for collecting relevant data to support the need for a workplace violence prevention program for healthcare facilities throughout the state. And this data will be used to support a commission to review and analyze healthcare workplace violence and safety issues that are affecting our healthcare workers and organizations. As the executive director overseeing security, I'm aware of the reports of assaults on our employees. On many occasions, we would call the police to report an assault on a healthcare employee, only to be told by the police that they would not make a warrantless arrest, but rather apply for an arrest warrant. Imagine how frightening it is for our healthcare workers who are victims of an assault and then have to remain in close proximity with the assailant to provide care for them. I believe the decision not to arrest is based upon the language in the current statute under RSA 594.10, which reads in part, "If not immediately arrested, such person will cause further personal injury or damage property." This language essentially requires the officer to predict future behavior of the suspect in order to make the warrantless arrest. In my opinion, not making an arrest at that juncture places the victim in peril, requiring another assault for a warrantless arrest to be made. This equates to a pattern of abuse. With the unique perspective of having been on both sides of this issue, I wanted to amend the language to provide the police with more clarity in the statute, which would give them greater confidence in making a warrantless arrest, while at the same time providing our healthcare workers a measure of safety and assurance. The result of this endeavor was the amended language to RSA 594.10, which now clearly authorizes the police to make an arrest without a warrant for an assault against a healthcare worker. Thank you for allowing me this opportunity to address this matter, and I would again like to thank everyone who's involved in the effort.
Thank you, sir. Questions?
No, thank you very much.
Thank you. I would now recognize Margaret Drew. Good morning.
Good morning. Thank you very much, Senator Gray and co-sponsors, for doing such hard work to try and make our workplace and healthcare safer. It is a huge issue that I have personally experienced and that my peers and friends have as well. It has a dramatic impact on your ability to provide care and sustain a career in healthcare when you fear going to work every day. I have submitted my letter of testimony. You all have it in front of you. My name is Margaret W. Brew. I'm a master's prepared registered nurse. I have been a nurse for 41 years. I'm employed currently as a healthcare workplace violence prevention educator at 2 New Hampshire hospitals, and I do support this bill. Senate Bill 459 will empower healthcare organizations to assess and address issues related to providing a safe work environment. It will afford healthcare workers the ability to attain skills to promote their personal safety. It promotes reporting of events, and it supports those harmed. It will provide a collaborative network to address healthcare workplace violence for all New Hampshire healthcare facilities. This in turn will have an overall positive effect on patient outcomes. My professional endorsement of Senate Bill 459 is in relation to, number one, education in de-escalation, non-physical intervention skills, and self-defense techniques, all of which I currently teach. The healthcare worker will have skills to effectively manage situations that pose a risk to their safety and the decorum of the organization. Number two, required reporting. This bill will promote a culture of reporting. Reporting of events provides data that organizations will utilize to address issues. This data will support policy decisions, changes in practice, and potentially will decrease events of harm. Number three, establish a process for follow-up and support of victims and witnesses affected by workplace violence. Providing support to those affected by healthcare workplace violence has a direct impact on patient care and patient clinical outcomes. This includes the provision for arrest without warrant. In each class that I've taught in the past 9 years, students have shared their experiences with healthcare workplace violence. The students that attend my classes work in varied roles within the healthcare system, including providers, nurses, security, and ancillary services. Their stories illuminate the personal cost of violence and its impact on the ability for individuals to perform their roles in healthcare post-event. Students have shared experiences of physical harm, such as showing scars from physical altercations. They have expressed their dissatisfaction that they perceive reporting events will not have an effect on improving safety. As well, they have discussed how events they witnessed have made them question if they want to continue to work in healthcare. Students expressed this after the shootings at Dartmouth Hitchcock Medical Center and Wentworth Douglas Hospital. One student, a registered nurse, shared a story of a physical attack by a patient. Due to the severity of the attack, they required emergency care. Diagnosed with a closed head injury and per physician order, they were out of work 6 weeks. Upon their return to work, coworkers and the manager were unsupportive. They did not understand why the nurse had to be out of work so long after the injury, stating, "You should expect this when you work with patients." The anguish on the nurse's face as they recounted the event was a clear sign that the physical harm was only a part of the injury that they sustained. The importance of addressing healthcare workplace violence has a direct impact on the health and welfare of the citizens of New Hampshire. The citizens of New Hampshire need a healthcare industry where the staff is safe to provide care. Workplace violence prevention education will afford staff the skills to advocate for their personal safety. It will promote a culture of reporting and build a collaborative network to address issues that will affect the overall function of the healthcare industry. The fiscal impact of promoting and providing a safe healthcare work environment is critical to the overall financial stability of the hospitals and the state of New Hampshire. Thank you all for your commitment to the well-being of healthcare workers. Thank you.
Thank you very much, Ms. Brew. Any questions? Thank you very much.
You're welcome. Thank you.
I have one more person signed up to speak, I believe, if I'm reading correctly, Pam. Okay. Okay. Good morning. How are you?
Morning. Good, thank you. My name's Pam Dinapoli. I'm the Executive Director of the New Hampshire Nurses Association. I wanted to thank Senator Gray for his work on this bill. Senator Sherman, as you know, the New Hampshire Nurses Association has been working for a couple of years to try to get a bill that's going to protect our healthcare workers, specifically nurses. So we're really happy with this bill. I submitted my written testimony. I also sent to you a study that we did recently to try to collect data on the accurate numbers of violence in the healthcare setting. Paula Minahan referenced New Hampshire Nurses Association work on this bill. We modeled the bill after the Joint Commission's new recommendations. So in January, the Joint Commission came out with much more robust recommendations for hospitals to follow. So not all hospitals in New Hampshire are Joint Commission accredited, so some are DNV. So we thought that incorporating a lot of the language from the Joint Commission will cover those hospitals who also are not Joint Commission. I'm not going to read my testimony, but I did get testimony from a nurse who's working in the emergency department, and I just thought some of her stories were really important for you to hear. She says it was 2:30. I got to put on my glasses here. It was 2:30, and the banging and yelling coming from room 332 was terrifying. This is a 34-year-old male here with an abscess to his arm. He needed surgery. He's withdrawing but had been okay. Emily had just called her supervisor and security for help because he was smoking in the bathroom and had a needle and a dirty spoon. These were disposed of, but now he's more angry and throwing chairs around his room. She calls a code gray, which is what we call in the hospitals when we need security, and the supervisor. All the what-ifs run through Emily's 27-year-old head. What if he comes out here? What if he hurts the patient next door? Can I call the police? He's withdrawing, he's screaming, he's swearing. The supervisor arrives, and he calls her names, which she writes down here, and that he's going to find her and kill her. Bonnie has worked the emergency department at night for almost 20 years. Agnes, a 41-year-old, comes in at 23:30, complaining that the tattoo artist pushed too hard on her shoulder and it's dislocated. As there's a code blue in progress, the ED is busy. Agnes is impatient. An LNA enters to see if she needs anything and is met with quite foul language. I don't need some nurse wannabe. The LNA does her best to calm and redirect to no avail. Bonnie brings Agnes a sling and meds for pain. Agnes is pacing around the room yelling. What took you so long? Not like your job is hard, just get me a sling. Bonnie also tries de-escalation. She even notes the de-escalation failed and she was sending another nurse in to try. The doctor attempted to see Agnes, but by then she was then parading in the hall of the ED screaming. Nurses try to shut rooms to other patients. Security is there as well. Around 20,000, an ambulance brought a patient into the ED for an overdose. Awake now, they bring her to a room. She's angry that she isn't high anymore. She has a prosthetic leg, which she pulls off and swings at staff, hitting an LNA. Her leg is removed from her possession by Eileen, who reiterates our zero-tolerance policy. The patient continues to berate, spit, and swear at Eileen. The ambulance came to pick her up and bring her home. The ambulance company returned to report that Eileen, the patient, had continued to threaten Eileen and her family the whole way home. She goes on in this testimony to describe what she did, but she says that these 3 cases all happened last weekend at her hospital. So if you think about the number of hospitals in the state, and that's one day, 3 events, the violence is not made up, and a lot of people feel like that it's not really happening, but it is. The other point that she makes is that when she teaches, so what, like Margaret was talking about, this person also teaches some of the Moab classes, and she says when she does orientation, she asks the participants how many have been hit by a patient, and she says 95% will say yes. If she asks the same question and says, how many of you have been assaulted by a patient? She says only 25% say yes. So there's a disconnect between what assault is and what actually should be expected. So nurses should not expect to be hurt in the job. And I think what this bill does is help us to define exactly what is violence, so we help them have a voice to describe what's happening to them in the emergency department and throughout the hospital.
Thank you, Ms. Dinapoli. Any questions?
I just want to give you her stories. I also have another copy of our study, and I also just wanted to say that there are federal, the American Nurses Association is working towards this. There's a bill in the House that was approved, H.R. 1309, that protects nurses, and this is a flyer that they have that describes that. So we really encourage you to support this bill, and thank you for your work on this.
Okay,
Questions?
thank you. Are there any questions? Thank you. Ms. Stevens did indicate neutrality, but also not wishing to speak. So is there anyone else who wishes to speak on Senate Bill 459? All right, seeing none, we'll close the hearing, and I will
Move to go into
entertain a motion.
Executive session.
Senator Gray has moved exec session. Senator Avard has seconded. All in favor, say aye. Aye. Why don't we start with this bill, since all of our witnesses
Move
are
on
still
to
here?
pass.
Can I introduce a committee amendment on that one part?
Yep, it's been moved on to pass, so Senator Sherman, go ahead.
I believe it's page 2, line F. Based on the testimony today, let me just see if there's a, I would add.
So you are at the bottom of page 2.
Right,
Line
line
36.
36. If the incident involves a patient, the report will include their diagnosis and whether or not disability or mental illness were a factor.
Do we want to say behavioral health, whether they're
Behavioral health.
behavioral health concern?
Whether behavioral health or disability were a factor. And then, let me just finish, and then the last line would be the patient's name or other similar identifier shall not be included in the report.
Senator Gray.
My only concern over that is that I could probably go into this report and find, things. And the commission is there. The commission, can make, like I say, on page 4, there's several points in there where it says, shall include, but is not limited to, about the data that they're collecting and how they're collecting it. The more I put in this particular section, the harder it is for them to make adjustments, when they need to. So I'm trying to reach that balance between, letting the commission do their job and do the things that we're asking them to do, and requiring to do something which the commission may or may not agree with. So, right now, I would think that the bill, as it is, without the amendment, would allow the commission to do those things, should that be needed, and does not need to be specified, in the page 2 language.
Go ahead.
So what we heard over and over and over again on the committee was the concern that we may be actually ending up focusing on people with mental illness and disability. And the commission, as it stands right now, will have no information on that aspect and no way to go back and get that additional information, because line 36 and 37 on page 2 says that the patient's name or other similar identifiers shall not be included in the report. So they would have no way to go back to the hospital. They could go back to the hospital but they would have no way to go back to the hospital and ask for additional information. So a diagnosis is very simple. It's a code. And Chris and Paula already said that that might not really indicate whether or not there was a behavioral health component. But asking for the diagnosis, which may be psychosis or maybe schizophrenia or maybe that would be helpful. And asking if there is a behavioral health or disability involving that patient is another checkbox. It's not, we fill out these forms all the time in quality assurance in hospital and healthcare settings. So you're talking about using something that's actually a pop-up screen on your computer. What is the diagnosis? And the other one, is there a mental health or disability involved, is a checkbox. I don't think that's asking too much of the hospitals, but that's all you need to be able to answer the concerns of the advocates who were a huge part of this process.
Senator Gray, then Avard.
So in an effort to reach a compromise, if in line 37, I add, pick away the period and say, but may include information such as diagnosis code, and I'll give you one or two more in there. Does that get you where you need to be?
Yeah. May I answer, or would you like Kevin? I would say that would get us in an enabling fashion, so it would allow it, but it wouldn't require it, and I'm fine with that.
So while Senator Avard is speaking, you can come up with the
I'll do some words.
the button words and.
Is there anything in this bill that precludes that would prevent that?
Not that I'm.
And that's why are we overcomplicating it?
I think if it's a but may include, that's enabling, it's not required. I don't know. Paula, do you want to weigh in?
I think that would work, and
That would not have been a good thing.
I think that would work. And I would prefer, honestly, if we could just kind of fix it now so that it is addressing that concern. And I guess I checked with Pam, and I don't speak for her, obviously, but I think if you ask her, she would shake her head that makes sense. So we probably should have been a little bit more deliberate when we came up with this list, but adding the language, and I'm stalling to give Senator Sherman a little bit more time to draft the language, but I think we can get some language, like you said, to include that behavioral health or diagnosis of behavioral health or disability, if were a factor somehow. To include, if it were a factor. How do we put that? So yes, I think it would work.
All right, so if the sentence read, if the incident involves a patient, the patient's name or other similar identifier shall not be included in the report, but the report may include
The patient's diagnosis code and whether or not behavioral health or disability were a factor.
That works.
All right, so one at a time. Senator Sherman, go ahead.
I like the way we did that. It was kind of tag team. Okay. So starting at line 36, section F. The incident involves a patient, comma, the patient's name or other similar identifier shall not be included in the report, but the report may include the patient's diagnosis code and whether or not behavioral health or disability were a factor.
All right. For Cam's sake, can you repeat that again slowly?
Trying to think of a slightly better grammatical phrase.
No,
but-
I think that works
Okay.
grammatically.
So, Cam, it's exactly what's written, and then there's a comma. But the report may include the patient's diagnosis code and what
Easy.
diagnosis code and whether or not behavioral health or disability were a factor. Period. I just want to point out that we're using the subjunctive there, which is really cool.
All right, I'll read it.
Are you going to take out my citation?
No, it's a committee amendment. That way, two of us have it. All right, so on line 37, after the word report, but the report may include the patient's diagnosis code and whether or not behavioral health or disability were a factor. We good?
Spectacular.
All right.
Thank you.
Senator Sherman has moved as a committee amendment the language that we have just read. Is it seconded? Seconded by Senator Avard. Any further discussion? All in favor, say aye.
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 Any opposed? All right. Senator Avard has moved on to pass, seconded by Senator Sherman. Any further discussion? I'll just say, great job, everybody that's worked on this, and thank you very much. All in favor, say aye.
Aye.
Senator Gray, do you want to take it out, and do you want it on consent, or what would you like to do? Your bill?
Consent is fine with me if I see any head shaking, no, I don't.
All right, so Senator Gray's going to take it out, knowing that Senator Sherman wants to speak on it.
Okay.
I'll be brief.
The enforcer will bark.
Right.
All right, great job, everybody. Let's, we're in executive session. Since the commissioner is here, we're going to start right at the top. Everybody should have a list that Cam has done a wonderful job of providing. Cam worked incredibly hard through the break week to,
Sam, do you have an extra copy of the list?
here, we can share this.
We'll share.
So, we'll start with 287. Senator Sherman, before he went away during the break, had worked with Tyler, the commissioner, hospitals, and others on a potential compromise amendment. There was a compromise amendment that was reached, but it had two versions. Version 1 was without the dispute resolution mechanism. Version 2 had the dispute resolution mechanism. I only drafted version 1 because I had so much input from the Hospital Association about the dispute resolution language. So I'm gonna, what I suggested to the commissioner the other day and to Paula was that unless there was an agreement reached this morning, here and now, we would hold off on executing the bill, and that they would have another dispute resolution meeting to see if they could resolve the dispute about the amendment. But I'm also going to give the commissioner a couple of minutes to discuss it, as well as Ms. Minahan after the commissioner. So, Commissioner? Actually, it's better if you, yeah.
I think we've already scheduled our meeting for the dispute resolution. I accepted that last night, and we're happy to keep working on it. The No Surprises Act, I think, is the number one consumer protection issue that we have, tool that we have available to us now. In large part, it's going to be put into place whether the New Hampshire Insurance Department moves forward with this bill or not. We looked at this over the summer and thought if we were going to protect consumers, we thought it were best to have them have a place here in New Hampshire where they could file their complaints, where we could educate folks, and where we could ultimately handle any disputes that came up. The method that we developed for that is a method that we used 2 other times recently. We used that when we passed the No Surprises Act, and we used that in a workers' comp fee payment dispute 6 years ago now. It's a process that uses administrative action at the Department of Insurance. Both times that we adopted this language, there were a lot of disputes about how this was going to work. 6 years in now, we've never had to have a hearing. We've not had a single complaint come through to a hearing, in part because just having this tool there has been an incentive, has allowed the parties to find a commercially reasonable resolution on their own. I think they decide that they can get to a table and figure out their differences, knowing that ultimately there is a process for disputes when they can't. I think our team of 76 staff at the department are equipped to assist with these if they come. I think New Hampshire consumers would want to know that this process will happen here.
I would just add that it's very much like some of the other federal laws that have come before this one. Think mental health parity, think the ACA. We need state authority to enforce those laws. There's always been a lot of legislative interest in making sure that we're able to do that at the state level. What we were proposing was really to piggyback on this federal law, use the methodology as much as possible, but tweak it for additional considerations at the state level. I think that if that doesn't work well for the parties involved, we meet every year. You guys can make changes. But right now, we're deferring to the federal law, and we're really leaving it up to them. The problem with balanced billing dispute resolution is the providers want to get paid more, the carriers want to pay less. You've got to come up with a methodology that works as best as possible for both parties. To the extent there's a lot of investment in resources at the federal level from the provider community in challenging the way that methodology is going to be used, that's what's going to be debated. But we're looking for the flexibility to use that federal methodology, whatever it becomes tomorrow, but take into any state-specific considerations. So at some level, it's kind of a philosophical difference about whether or not we should do it at the state level or whether or not it should be done at the federal level.
And then finally, I think New Hampshire is in a much better situation than many other states, in part because we have really a wonderful balanced billing law already in place, and also because our networks are pretty expansive. Virtually all the hospitals are in network already with all the carriers. There are a couple, too, that have some holes, but the vast majority of them already are in network, and so we don't think there's going to be we don't expect that there would be a whole lot of disputed claims.
Question, Senator Sherman.
First of all, I just want to praise the department for the work they've done on dispute resolution and to date. But I do have a question. Isn't it true that outside of the 4 areas that you currently cover with the balanced billing law that we have in place, that the federal mechanism is still in the court system and is still being worked out?
Yeah, so there is a debate about the actual methodology, which is why the New Hampshire law for the 4 specialties we mentioned is commercially reasonable. The federal methodology basically relies on the median in-network rate for the carrier, but allows additional considerations to come forward. I think the assumption among the provider community is, wow, that's still too low for us. We'd like to see more flexibility or an increased amount. At the end of the day, I'm not sure how much there's a difference between what the state might consider to be commercially reasonable and what the in-network median rate, once you've considered other factors, really is. I mean, we're looking at sort of the provider's experience, education level, the complexity of the patient. All those things are considerations that certainly could be brought forward in a dispute in New Hampshire.
Further?
So I know one of the concerns of the provider community was that you actually were changing the basis for the determination, and I'd have to go back to the original bill to understand that. They are in agreement with you, since I was a part of all those, a lot of those discussions. They're in agreement with the department that the current system in New Hampshire is working. But you're changing the basis for the current system to, what is it called, the provider?
QPA.
QPA, that's it.
Yeah.
So the concern I have is that why would we change the system now when the actual federal guidance is in flux and the system is working for our four areas? So what the amendment from Senator Bradley anticipates is that probably within the year we will get the final federal guidance. And then we could put in, for dispute resolution, we could incorporate that into the state level. And as you said, we come back every year. So what's the rush at this point, since we know those four are working and we know there's going to be federal coverage for any expansion of balanced billing?
I think that if there's a rush, it's because right now that federal law is in effect. I think to the extent that we're waiting what is more than a year before we'd have another shot at being able to resolve those disputes, that's the potential problem. I think to the extent that we moved from the original bill, which had very black and white guidance about what the QPA was going to be. At that time when we drafted it, there wasn't the additional federal guidance that said you could consider other things as a part of the dispute resolution. So when we drafted the other amendment, remember we got two amendments now, it clarified that the state even has additional flexibility to move away from that QPA, even included a sentence that said the insurance department could require the parties to go to mediation before an appeal to the insurance commissioner. So it sort of, again, gravitating more toward that flexibility. The only types of changes I think we're going to see at the federal level going forward is additional flexibility, additional considerations for what the parties might bring forward in terms of their position, pay more, pay less. We already have that embedded into the amendment and really in the history of the New Hampshire statute when it comes to balanced billing dispute resolution.
Okay. Well, I look forward to seeing what you and Paula come up with.
Yeah, I would say the only challenge in doing that is there's just a basic philosophical difference about whether or not it should be done at the state level, the federal level. I'm not sure how much room there is for compromise on that. Perhaps the hospital association's got some additional ideas, but I think that's the challenge, and that's really a legislative policy decision.
Right. I think the other, if I could, since we're in exec session, the other challenge is making it something where it's not dependent on one person in the end. That was what I heard over and over again, is that this puts an awful lot of power. And as you've said, Commissioner, you've not needed to use it in the past, which is great, but it does, that's the final word, and that's a concern for providers. So I think that's another area where you might think of some creative compromise.
I appreciate that. We've heard that in the meetings we've had. I don't believe there's going to be a lot, but we don't know. And that's why we adopted the mediation language to put in, which potentially will give us an opportunity, if we see a number of complaints, to use that process to give them an extra chance before they come to us. I think it's also important to understand we don't charge when we do that. So I assume lawyers somewhere will be charging, but the department won't be. It'll be a free service that we're able to provide under the services we're already providing. And I also can assure you that very little gets done in my office by one person. We've got a lot of experts there. We do things as a department.
Okay. Thank you.
I'll have that meeting tomorrow.
All right, Paula?
Thank you. I don't have a lot to add, except our position is that the patient is protected now because of the federal law, so that is important that everyone understand, and we absolutely support that. And what we were comfortable with, is the amendment, I believe, Senator Bradley's amendment, that 0977, because that is taking the kind of controversial, I don't know if controversial is the right word, but the I don't want to use dispute either. The areas that we all agree on are in this amendment. And again, not to reiterate what Senator Sherman said, but there are legal challenges with some of the federal guidance. So we're just uncomfortable right now moving forward until that gets resolved. The hospitals fall under the federal guidance. So to have two separate differing ways to calculate QPA or what, commercially reasonable, whatever we call it, is uncomfortable. And again, right now, balanced billing law while, you know, it was, has been in place for a long time and fortunately has not had to be used, it's only for specialties as has been stated. The hospitals are not part of that, but now they will be, and that's why we just need to make sure that we're taking all factors into consideration, that's all. So we're just, and again, we are happy to continue to talk, and we will continue to talk. But we need to just make sure that everyone's comfortable with how we proceed, that's all.
Okay,
So thank you.
we will await the results of the dispute resolution on the amendment. On dispute resolution, yep. All right. Senate Bill 288, that's Senator Avard's bill on school vaccinations. I continue to look for a compromise that all 5 people can vote for. I continue to be stymied, but I'm going to march on and see what happens. So I'd propose that we skip over that for today. So the next bill would be Senate Bill 320. There's been a lot of discussion about that. My recommendation at this point would be interim study. I think that and I've spoken with Senator Susi, the sponsor of the bill, there would be an opportunity when there are contract disputes on what's in the provider manual, or, as was alleged in the hearing, the changing of the terms of the contract for the parties that felt aggrieved by something to be able to go to the insurance department if it is something that is a change in contract. I think if we have a motion for interim study, Senator Sherman and I will have that discussion on the floor, so that the record is very clear about the oversight role that the insurance department plays. Senator Sherman?
I just wanted to ask, if I could, a quick question of Tyler on
Sure.
this, just so I
Go
have
ahead.
a clear answer. This has been a huge educational experience for me about the provider manual and the contract, but what I take away from it is that this is really about what the contract allows to be done in the provider manual. And the providers don't feel like the contract negotiations are performed in good faith. In other words, contract negotiations, they're given the contract and it's take it or leave it. And I'm not saying I necessarily agree with that. I'm saying that's what I've heard from the providers. Does the Department of Insurance have the ability to step in and say, we need to have a really solid, even playing field discussion or negotiation on the contract so that everybody is heard and their concerns are addressed in the contract? The reason I say that is because hospitals are in a really tough position of having to take the contracts, because the ones who get hurt if they don't are the patients. So if all the hospitals stood up to the insurance industry and said, look, enough. You cannot continue to manipulate us in this way through the provider manuals. And we want it in the contract, a much stricter use of the provider manual. The people who get hurt by that are the patients, because no longer will the hospitals necessarily be participating with those carriers. And I think the hospitals are unwilling to do that. Does the Department of Insurance actually have a role in making sure those contract negotiations are on a level playing field, or do you have to stand off?
Generally, no is the answer. There are the provider contract standards that are in statute that we would enforce. In other words, the contract between a carrier and a provider needs to include certain provisions, and that's stated in law. There are other laws that may relate to the contract and reimbursement levels, perhaps something like mental health parity, but the reality is that what we hear all the time is that there are very different positions of power in these negotiations. Think your mental health providers who feel as though they're often independent, have no bargaining power with your insurance carriers. They're in a take it or leave it situation with their contracts. On the other end of the spectrum, we hear that carriers have very little negotiating ability with hospitals. And indeed, historically, it has been proven very difficult to sell insurance products in New Hampshire without even one or two hospitals in the network. You generally have only seen that in the individual market. I think, though, this bill and what the intent is much larger than either the contract or the actual provider manual. Has to do more about benefit provisions, which often get administered through the systems that are used through the provider manual and to a degree through the contract, but are more so about benefit provisions on the side where it's administered to the employer or directly to the subscriber. Think where you're going to get access, where you're going to have prior authorization, where you're expected to receive care. And those things are difficult, I think, for providers to anticipate when they're negotiating the contracts with the carriers.
Senator Whitley.
Thank you, Mr. Chair. Thanks for taking another question. So in learning more about this process also, I think some of the areas of concern are related to sort of a lack of communication, right? And so there's some notice issue. So do you think the Department of Insurance has a role in improving that notice process between, the carriers when it does happen? Do you think the Department of Insurance has a role in improving that process?
That is a policy decision. It's not unusual to have certain timeframes associated with notice provisions. Most of those notice provisions are dealing with the member. So largely the reason we exist is to protect consumers, protect people who are buying health insurance. There are, though, provisions on the statute that are intended to protect providers, and there are sometimes done through those provider contract standards. And so that's a policy decision. If you do pass legislation that does require a certain time frame before making changes, and those changes need to be notified one way or another, we'd be happy to enforce those provisions for sure.
Follow up? Are you aware of whether those contracts that are negotiated have those notice provisions in there for changes in the manual?
It's not it's now been 20 years, but I used to do the contracts for a carrier, and there were provisions at that time that dealt with notification or before changes could be made. And they always would say this is the controlling document, being the contract, not the provider manual. That being said, I think it's hard for the parties to anticipate everything that's going to happen over the next year. So it's, you do the best you can, but I think it's easy to see how somebody could be surprised.
In my view, the bright light of sunshine on this issue has probably done more to resolve the issue than any piece of legislation possibly could. So I think everybody has had their voice heard. Some people have spoken up. Some people have hopefully listened. And hopefully it doesn't end up in your lap.
Thank you.
I'm always hopeful. All right, Senator Sherman has moved interim study. It's been seconded by Senator Gray. Is there any further discussion? All in favor, say aye.
Aye.
Any opposed? Okay. Since there is going to be a discussion on the floor, Senator Sherman, you want to take it out or do you want me to take it out? All right, I will take it out. All right. Moving right along. Let's move to Senate Bill 332. So we had a hearing on this bill the last time that we met. As you recall, I asked the department because there was no fiscal note attached to it for some reason. So I asked John Williams in the department to try to estimate what the cost would be for this 6-month initiative based on the stipends that were paid at the beginning of the pandemic with CARES money. I see that everybody should have gotten a copy of this email. Does everybody have it? In any case, John, why don't you come up and talk about the potential cost, which would appear to me to be $113.3 million plus a couple of new positions to administer it.
Senator Bradley, members of the committee,
Good
thank you.
morning.
I just wanted to provide credit to Rich Labors, the Deputy Commissioner for the New Hampshire Employment Security. He was instrumental in putting together these numbers and did a really good job in getting it to us around Monday of last week. So we hope that's helpful information. I do know he's available in the building if there's additional questions that we can't field, Senator Bradley, but I think it does provide you with an overview as to what we expect based upon the experiences during the emergency order for what the cost would be. And that has also been provided to the bill sponsor as well.
Questions?
The
Senator
100
Avard?
Yes, thank you, Mr. Chair. The 130 million, is that for 6 months or for a year?
My understanding was that that Attorney Labor's Deputy Commissioner was responding to the 6-month period of time, the July 1st through the.
That's what the email says. So what I would recommend on this bill is that we have a motion of interim study. I don't think we can pass the bill. I don't want to kill the bill. The reason I don't want to kill the bill is that it is conceivable that the fiscal committee would get a request for something like this, and it just doesn't seem to make sense to kill a bill. But all of the ARPA money now is going through fiscal committee as opposed to legislation, so that's what I would
move to
recommend.
interim study then.
Senator Whitley.
So, I think that so this is the policy committee, right? We are charged with looking at, listening to our constituents, listening to the community about what's really necessary. So I think if we are supportive in general of this policy, this is necessary. I wouldn't support an interim study because I think this is a policy we would support. If this is a financial issue, if this is a funding issue, if this is a mechanism issue about where it's appropriate, let finance do that. So my suggestion would be we, support this policy and let finance hash out the numbers.
Senator Sherman.
If you would indulge me, I would like another week to talk to the prime sponsor about this. If Senator Avard were willing to withdraw his motion, I'm, my eyes are kind of wide on the cost of this, but I would like to give the courtesy to the prime sponsor. And while I think this is a policy committee, that doesn't mean we have a really fat wallet and carte blanche. And so I would lean in favor of an interim study, but I would love to have the courtesy of another week.
Well, what I would suggest, because we are backed up against deadlines, is that we try to take action today. And since the bill's not going to be on the floor until next week, you'd have that week to speak with him. And obviously, it could be, the recommendation could be changed on the floor if that was the will of 13 members.
I guess what I'd say, if I have to vote today, I'll vote against an interim study. Not that I necessarily disagree with it, but right now I'm not prepared to.
I know we have a lot of bills backed up, and so I'm kind of leaning.
And we, excuse me, need to start House hearings soon. So I'd prefer to, if it's all right with you, I mean, if you really object,
I really object.
And I do also, we have one more week to get fiscal bills,
we'll
so.
wait till
yeah.
next
Well,
week.
this doesn't
Thanks.
have an FN, so.
Yeah, it does.
Doesn't
now
have an
it does.
FN, but
Right.
Now it does, yeah.
it sure as
It has a
heck has
colossal
a,
FN, actually.
Yeah.
colossal
Yeah.
FN, right. Okay.
I'll
all right,
withdraw my motion.
Okay.
Thank you, Senator.
Thanks, Senator.
All right, let's move to Senate Bill 372. This is my bill that I brought forward on behalf of a constituent. If I can find the bill, I will give you my recommendation. And that be that we have a committee amendment to strike Section 3 of the bill and just retain Section 1 and Section 2. I don't know, based on, what people have told me, that anybody is willing to second that, but that would be what I would like to see happen.
So can you repeat what you're talking about doing?
Strike Section 3.
Is Paula still here?
Nope. All right, why don't we skip over this bill and come back to it? All right, the next one is Senate Bill 401, which is
Did we skip 374?
yeah, I just soon, let's wait on 374 for right now. We can maybe come back to 374.
Do you have an amendment on 401?
I do, and I'm looking for it.
Do you need a motion?
Yep.
A motion ought to pass?
I'll second.
Cam, do you have an extra copy of the amendment?
There's two. Are we talking about 0958S?
0958, that's correct. So,
I guess you could bring me one too.
so as you recall, from the original bill, it was very simple. It was just a straight 25% increase. There was a lot of discussion about that, and the Hospital Association, working with the department, came up with lines 16 through 18, which gives the department discretion to implement the reimbursement increase and adjust it for geographic risk, as long as critical access hospitals receive nothing less than a 20% increase. Henry, do you want to discuss that? And then the department came back to me with the commission, which I've included in this amendment, although I think you had about 5,000 members, and I think I've reduced it to about 20. Go ahead, Henry.
For the record, Henry Lippman. Let's get a little close to the mic here. Lines 16 through 18, as you were referencing, I just want to clarify for the other members here that the 20% is for any hospital, whether it be a critical access or a non-critical access hospital. And that was through discussions and modeling of what rates flexibility we would have that we reviewed with the Hospital Association, and they were good with that. I know Paula said to me she was good with this. She had to run out to another hearing. So we're very comfortable with that. And we're comfortable, we know how commissions are viewed these days. And, I think that to the extent that you have to help staff them, we want it to be acceptable to you. So we're comfortable with your changes there as well.
Okay, questions of Henry? All right, so let's move to page 2, because I think I did not want to overburden OLS with repeated changes because probably did what, Cam? 20 amendments last week, at least? So I would recommend that it was a recommendation of the Hospital Association, excuse me, on line 27 and 28, that there be a representative of a critical access hospital and a non-critical access hospital. So what I'd recommend that we do, and what I should have done, is use line 16 and 17 to clarify it there, but I didn't. So what I'd propose that we do is take the language offering labor and delivery services operating in rural New Hampshire, appointed by the New Hampshire Hospital Association, and put it after the line 28, critical access hospital, and drop the gubernatorial appointment. Because it was always the intent that the Hospital Association appoint their members, and it should be reflective of, I think, offering delivery and labor services.
So we would still end up with two.
Two.
Not three.
Not three, two.
Got
Okay?
Yeah, a critical access and a non-critical
A
access.
critical access and a non-critical access.
That makes sense.
Okay, Cam, you got that?
So line 27, 28 read, a representative from a critical access hospital offering labor and delivery services operating in rural New Hampshire, and a representative from a non-critical access hospital offering labor and delivery services operating in rural New Hampshire, each appointed by the New Hampshire Hospital Association.
So, I think, let's refine this a little bit more. All the critical access hospitals are pretty much in rural New Hampshire, okay? Representing two of them. So, why don't we strike the word rural in that language and have it read this way? A representative from a critical access hospital and a representative from a non-critical access hospital offering labor and delivery services operating in New Hampshire, appointed by the New Hampshire Hospital Association.
Can I make one little?
Yep.
I would put that up in line 10 and just delete 16, then you won't have to do any renumbering.
I'll leave that to Cam and OLS. Okay?
Just making life a little easier.
Thank you. All right. One other thing that I got yesterday afternoon from Heidi Kroll was in the duties of the commission, and I think it makes sense to amend this somewhat. So, if we look on page 2, line 30, studying demographics of rural New Hampshire communities, she would propose that we add the words "and trends in birth rates." Okay? That, to me, makes sense.
Can I ask a question on that?
Yes, you may.
May I? Thank you. Do we only care about rural New Hampshire communities, or do we care about all New Hampshire communities in this? This is really focused on rural, correct? The commission? Yeah, it's rural. Never mind. I take it back.
Okay.
If you put birth rate trends instead of trends in birth, rate.
Oh.
Just grammatically.
You know, this is contagious, isn't it?
All right. And she would ask us to add a new 15 on page 3 after line 22. Reviewing and evaluating alternative models of delivering care with respect to labor and delivery services.
Yep.
I think that obviously is the entire intent of the commission, but no problem spelling it out.
Can you repeat that one more time?
Yes, I can. Reviewing and evaluating alternative models of delivering care with respect to labor and delivery services. And Cam, I have this if you need it. And that would be a new 15. Okay, is there a motion on this as a committee amendment?
Move.
All right, moved by Senator Avard, seconded by Senator Gray. Further discussion, Senator Sherman?
Just making sure there's mileage. Is it in there?
OLS never misses
I've
mileage.
seen it once.
Is that like $7 a gallon?
Right.
I don't see it, so I'm just checking. We've actually had to do a floor amendment previously, but not.
Oh, really? All right,
Okay.
it's not in there, so
Is it in
Cam
the
is
original bill?
authorized. Good pickup.
Deplete my $100.
No, it wouldn't deplete your $100, it would deplete your, gas tank.
Yeah, that's it. Happy to do it.
Okay, so it's been moved, it's been seconded. With that, Senator Sherman, add on. All in favor of the amendment, say aye.
Aye.
Any opposed? All right, is there a motion of ought to pass as amended? Moved by Senator Sherman, seconded by Senator Gray. All in favor, say aye.
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 Consent?
Yep, if there's a motion for consent. Okay, seconded by Senator Sherman. All in favor, say aye.
Aye.
Anybody want to take this out? Senator Sherman gets the honors. All right, Senator Whitley,
Yes.
you have 3 bills in a row.
Yep.
We'll start with 416.
So 416, you may remember that the Office of the Child Advocate, New Hampshire Legal Assistance, and DHHS they were working on an amendment, and they had come to a place of agreement on an amendment, but it was suggested, and I agreed to touch base with the Department of Ed. They are trying to get a meeting with them, and there's been some trouble because of vacation, but I have told them this is time intense, the time is of the essence, so that we are going to work on getting a meeting with DOE ASAP.
And just to reiterate, I was ready to exec the bill as long as DOE
Yeah.
gave it the okay. I think there are, from what Commissioner Edelblut said to me, it's more technical issues
Right.
than substantive, so,
We're close.
yeah, it just has to be exec next week,
Yep.
okay?
Which amendment are we using?
716.
Yep. That was the one negotiated with DHHS, OCA, and NHLA. Thank you, I appreciate that time. And soon to be DOE ASAP. Ready to move on?
Yep, 444.
Senate Bill 444, you have the amendment that we discussed a couple weeks ago, 0712. Rebecca Ross and John Williams graciously provided their comments on that, so I think we're in a good place to move forward with that.
So I did reach out to John and the department about the appropriations in the bill. Because there had been a lot of discussion as to whether these had been funded already with ARP money, and looking for the email that I got back from Ms. Ross. I have it here somewhere, honestly, I do. Okay, so, I think the entire committee got this email. So the first appropriation was $700,000 for child-parent psychotherapy. And Ms. Ross got back to us and said the appropriation is required, but because this is intended to expand the scope beyond what's already underway. So that answers that one. Then there was $500K for children's behavioral health care provider training. And Ms. Ross got back to us and said the appropriation is required because this is intended to be in addition to what is already underway at public health. So that answered that one. Then the $1 million appropriation for the Family Resource Center, I think that was never in question. It hadn't been funded, and Ms. Ross indicated the appropriation is required because it's intended to be new funding for the FRCs. And lastly, there was some question about the $75,000 appropriation for the database, and Ms. Ross said the appropriation is required because it adds the creation of an entirely new system. So, oh, where Senator Avard went, the men's room. So my recommendation. She's too young for that. Yeah. My recommendation is a motion of ought to pass as with the amendment, obviously. Sorry, Senator Whitley. I think there are a number of substantive policy changes that are good and necessary, and there was obviously significant support for them in the public hearing. We'll see what happens with the appropriations when it gets to finance, but at this point, that would be my recommendation.
Okay.
So
Do you need a motion on the
Senator
table on the bill?
Whitley is going to move amendment 7 something,
0712.
0712. I think it already had been moved, right?
Okay.
All right, the amendment is moved, it's seconded. Is there any further discussion? Seeing none, all in favor say aye.
Aye.
Any opposed? Okey-doke. It's been moved OTPA by Senator Sherman, seconded by Senator Whitley.
Yeah.
Any further discussion?
I just want to say, I think this is going to go a long way to getting children, young children, the care that they so desperately need. And so I really appreciate the committee's work on this and support of all the various provisions.
Okay, all in favor say aye.
Aye.
Any opposed? Senator Whitley, your choice, consent or non-consent?
Yeah, that's fine. Consent is fine.
All right, Senator Whitley moves consent. All in favor say aye.
Aye.
Any opposed? Senator Whitley, you get the honors.
Great. Okay, the third one I have is Senate Bill 446. This is our Child Care Workforce Fund. So I did have Cam send around Amendment 0994. And just so the committee's aware, it's identical to the prior amendment that we talked about, incorporating some of the requests from HHS. What it does do, the only thing that the amendment does is remove reference to the first reference to the State Early Learning Alliance of New Hampshire web platform. The first reference that DHHS was concerned required a single source contract. So we just removed that portion to eliminate that, kept in the later reference that was more permissive. So we wanted to be responsive to that, but otherwise, I think we're good to go on that. And I just, I did want to just speak to it a little bit, if I may.
Yep.
Okay. So I think at this point, there is a historic amount of money coming into our state right now, and I really do think that, from what I've heard from my constituents, from our businesses, from our families, this is such an important use of that historic amount of money coming in. And I think, to target resources that are directly responsive to our businesses, to our families, to our providers, I think is a really great use of these historic resources. I'm grateful to the department. I know there's been a ton of work thinking sort of long-term about what's necessary to improve this sector in the future. That's necessary work. But I think, that long-term work won't really matter if our providers are closing their doors. And and we're hearing that this is a crisis point. Child care providers are closing their doors. They cannot get workers in the door. And that means I can't send my child to child care. I think all of our businesses won't have their employees because they just don't have this basic support for their families. So I think that this bill is such an important bridge to that long-term work that DHHS is working on, and this can all happen concurrently. So just going back to the core tenets of the bill, it was a bipartisan bill. I'm deeply grateful for Senator Hennessy and Senator Carson's co-sponsorship. Senator Hennessy in particular, we've worked very hard together on coming up with solutions that support a broad base of stakeholders, and I think this bill does that. The bill had really broad support. There were 91 people in support of the bill. It's also gotten a lot of media attention, I think, because this is an issue that care really deeply about. Care really deeply about. Senator Hennessy and I were asked to speak with Fred Koch on Close Up on WMUR. We got a great response from people about that. New Hampshire Business Review has covered this bill, Monitor, of course. And actually, there's been, if you do a search of media coverage on childcare in the past 2 years, not only on just this bill, there's been a lot of coverage. This is an issue that people really understand is a workforce issue. They understand it's an economic issue. And they also understand that this is an issue that really crosses socioeconomic lines at this point. I know personally, I have one child, he has 2 lawyers for parents. We have struggled with childcare issues, and we certainly know our low-income families are also struggling. I hear every day from my contemporaries that childcare is a problem. People are having to leave the workforce, and frankly, the reality is we know that women are having to leave the workforce. I have professionals who are my contemporaries who have left their jobs, who have had to cut back to a couple days because they just don't have childcare. So it's an issue that really a lot of our constituents are dealing with. And, I think lastly, the pandemic has really just exposed how fragile this sector is. We know that there are long-term solutions here that are so necessary. And, but we know that this is a large reason why women have just left the workforce in droves. We know that childcare is a big contributor to that. It's really, as a woman, approaching middle age, thinking that there will be a whole generation who have had to leave the workforce, resulting in pay gaps. This is a problem that needs a solution. I think this bill provides that solution. The appropriation, so the bill creates a fund, and the appropriation is only for 1 year. And going forward, the legislature will have the opportunity, in the budget process to think through whether this is necessary in the future. We know that there will likely be federal investment, further federal investment. We don't know what that is. We know that DHHS is working on long-term solutions. So I think this appropriation is reasonable. It's not a massive amount of money, but it is enough, we have heard, to keep these businesses open. So the last thing I appreciate the opportunity to speak a little more broadly about this. I also wanted to mention a letter of support that folks had signed in support of this bill. There were 1,800 signatures on this letter of support. That's a lot of people. Families, providers. There were also 195 New Hampshire businesses signing in support of this bill. So I think the amendment addresses the concerns of DHHS. We've been very responsive to make it workable for them, and I really hope we can get this across the finish line today. Thanks.
So, I guess in response, during the break, I worked with the department because there had been some reservations on the part of the department on how the funding was structured and how it was going to be utilized. And I think we probably remember that discussion. So I worked with the department, in particular Ms. Santiello, on a possible amendment that was a different approach, using actually a little bit more money than you appropriated. Instead of stipends to employees, was more of a grant initiative to child care facilities that would, with the hope that they would be able to be more sustainable and be able to lower costs to clients and pay their workers more. think there's a lot of support for that at the department level. When I thought about having it drafted into an actual amendment, I reached out to the governor's office, who reminded me that all ARPA dollar requests are going through fiscal. So I would hope that there'll be an ARPA childcare-related fiscal request at some point fairly soon. So I think you've identified a very real problem. I think that there's a need for more resources. This is, in my view, similar to the discussions that we have had for several years about housing issues. We have dedicated a lot of resources. I think that this is an area where you've identified a problem. I'm not sure that this, at this time, is the right solution. So I would be in favor of an interim study motion, but
May I just-
Senator Sherman, and then Senator Whitley.
I think leaving policy up to the fiscal committee without making a statement on how the Senate feels about it would be a mistake. So I think at the very least, if you and Senator Whitley were to come up with an amendment that you both agreed with, and we had that next week, that gave guidance to the fiscal committee on what would be the optimal program, since you've talked to Chris and Senator Whitley has done so much work, I would be much more in favor of a bill that made it through, gave the Senate position, and then passed the Senate, or worst case scenario, came to the Senate floor with a 5-0 recommendation out of here, because that's the policy that we want to see going forward, and then was tabled or went on to fiscal. But to just say, great ideas here from Senator Whitley, from Senator Bradley, and we're going to leave the whole thing up to fiscal, I think sort of negates the role of the Senate in actually making a policy statement. So I would vote against an interim study, because I think we can do better than that. I think you've outlined one solution. I think Senator Whitley has worked really hard on another solution, and I'm not willing to just say, okay, well, these are great ideas, let's let fiscal decide. I think we need to put the Senate position on this in writing, and that might need to be on hold, but at least our position will be heard.
Senator Whitley?
Yeah, and I hear that, that there is some sort of tricky mechanisms here with ARPA dollars, but, similar to the prior bill, there's a lot of policy attached to this. This bill, if you go through it, talks about, why this fund is necessary. It may at this point fund it with ARPA dollars, but there is a whole heck of a lot of policy attached to this. And so I agree with Senator Sherman that if we agree with the notion of this sector needs this workforce, these are direct dollars, that we need to move forward on this. And I want to express some disappointment. I spoke with the department just last night, and this is the first that I'm hearing about, a different structure to the whole bill. This bill has had a really robust stakeholder involvement. Again, 1,800 people. And I heard from you just mentioned one person from the department wants to derail it. That person did not reach out to me with that new structure. That's one position, but 1,800 people feel that this is the right structure. And so I think that's really problematic if we let closed door, one call derail what our community wants, what our community needs, what our businesses need, what our families need. Like this is people aren't going to be able to go to work, right? If they don't have a place to send their kids, right? I'm the only working mom on this panel, and I know how this feels, not to have a place to send my kiddo. And that has left, in past, I haven't been able to proceed in my career This is a real issue, folks, and this is something that our businesses, the BIA, put childcare on the top of their priority list because they know how much this issue is impacting their members. So I think we are ignoring our businesses, we're ignoring our families, we're ignoring those 1,800 people if we send this to interim study. This is a big deal. So I hope that we can, move forward with OTP, have finance hash out some details if there's concerns about the amount of the ARPA funding, but this is a policy issue. There's a lot of policy in these bills, so I think, I really hope we take a strong look at this.
I support your idea of interim study, and I don't like the way that the financial part of this is structured. Yeah, there might be a lot of money that's coming in now, but there's, looking at the economy now, I don't know. In putting the, coming out of the general fund, I'm just not comfortable with this. Using ARPA funds, that's a different story, grants. But as it is right now, I'm surprised there aren't more people, wanting this, because that's $8 million. And who wouldn't want that help, right? However, the taxpayers are funding this as well. So as far as I'm concerned, I would support an interim study. And unless you guys can come up with a different structure of how to pay for this, maybe through ARPA funds and grants, I think that's fine. We've all gone through it. I have 3 children. I have 7 grandchildren, all right? I understand the whole situation, believe me. And we've paid our dues, and so have a lot of other people as well. But as it is right now, I cannot support not to pass with this the way it is written.
Senator Sherman.
Fundamentally, to me, it's bizarre that we would derail this, that, first of all, that we would let a single employee of the department derail this, which is what's happening right now.
I don't think it's a single employee.
Okay. Well, an employee representing the department. Second of all, this is 1 year. This is not subjecting us to many years of expenditures. And so, and third of all, this is about children. This is about families. This is about workforce. This is about business. What do we stand for if we don't stand for families, children, workforce? And, this is money that we have. Most of it's federal. And the pushback against this is a pushback against our families. It's a pushback. It's a push. Well, excuse me, I was speaking. So you can disagree with me. I'm sure it won't be the first time. But it is fair to say that the whole target of this, with the agreement of a large number of Granite Staters, is to make it possible for women to go to work, to make it possible for businesses to actually survive the post-COVID period here in New Hampshire for 1 year. So I think if it's not the opinion of the majority of the Senate, then that's one thing, that this is important. But if it is important, I would like to see the amendment of the structure that Senator Bradley is proposing and be able to take a look at that. And maybe that's an answer that all 5 of us could agree to on the policy. Then on the finance, it would go to finance. But this is paid for. This is not long-term. And we have been told that if we don't do something like this, we may actually lose businesses, lose workforce. And that's not 1 year. That's for a long, long time. We know how hard you are a businessman. I've been in business. I've run a 10-physician practice. You don't just close down and then reopen when the money's available. You have to be able to plan long term. And sometimes there's a gap, which COVID has been, and you need help. And I think that's what this does. So I would hope that we could come up with some policy that would give guidance to the fiscal committee. Because I'm afraid, and I think Senator Whitley, I'm sure, will be tracking this, that this support will not come out of fiscal without a statement of policy from the Senate.
Senator Whitley.
Yeah, and I just want to clarify, Senator Avard, the money is available. This is an ARPA appropriation. And I wanted to point out too, we haven't even spent half,
Amen.
right, half
Amen.
of our ARPA discretionary dollars. So these are funds that our communities are saying they will close their doors if they don't get this. They can't get the employees, right? So this is a perfect use of those temporary federal dollars. These are not general fund dollars, right? I agree with Senator Sherman. This is a pro-family, pro-business, right? Pro-women bill policy. And if we leave it to the fiscal, we're gonna lose this. I mean, we already heard that the department wants to do it a different way. Why would they go to fiscal in this way?
Just a clarification,
Yeah.
fiscal is made up of senators, correct?
5 senators, 5 House members, all in the finance.
So let me just finish.
Senator Gray.
Yeah, no, I just wanted to
Oh, I thought you were
finish.
finished. I
Yeah, no,
apologize.
well, the way that it works at fiscal is that proposals are coming to them from HHS. It's not like I could go to fiscal and say, fund this, right? Is that your understanding?
My understanding is that they're made up of senators and House members that go through this whole process, and they understand the process.
Let me just intercede here. The way that the ARPA funds have been distributed has been the department or the governor's office puts a agenda item on the fiscal committee. It goes to fiscal, they approve it, or sometimes table it and consider it later. So that's how the process has worked with the ARPA dollars. Senator Gray has been waiting patiently.
I find it disingenuous to say that we're either going to vote for the bill or we're going to kill it by putting it in an interim study. The real thrust of this is to get the dollars out to the people. If I am talking about how long that will take, passing this bill is not the way to go. ARPA funding through fiscal is the way to get those dollars out to those people who our 2 senators at the end of the table have said they need. So let's get them there. Let's say, fine, we're going to put the bill in interim study. We're going to push the department through both the governor's office and the Senate to go do their thing and get the money there. That's the important part. And I will be supporting the interim study motion.
Senator Sherman.
At the risk of being disingenuous once again, as an alternative to Senator Gray's saying, let's leave it all up to fiscal, I would say, since we all know what interim study means in the second year of a biennium, let's pass the bill in one form or the other, and then table it when it gets to the Senate. That's a much more, in fact, we've had this discussion on other bills. That's a much more effective way to have it available if fiscal doesn't act with alacrity. It would also allow the bill to come off the table if fiscal doesn't act quickly. So frankly, this gets back to trust me, I'm a doctor. Trust me, this will come off, this will go to fiscal, and fiscal will push this through. We've got a lot of stuff on the table in fiscal right now that's really important to the state. So if the mechanism for funding is through fiscal, I don't know that we've ever previously thought of fiscal as a policy committee, but maybe that's changed. So I would like to see something come out of this committee that we can pass, move to the floor. If you want to table it on the floor and hold it in abeyance for fiscal to provide guidance, that's fine. But I can't support interim study, which is basically killing it.
Senator Gray.
I could support tabling the bill on the floor if it gets there with a motion interim study.
May I?
Senator Whitley.
Yeah, so here's my biggest concern with fiscal. You know, again, we have policy in here, and fiscal is not going to develop policy. Fiscal is only going to say yay or nay to whatever DHHS or the governor brings to it, right? And so we already know that Chris Antonello, one person at DHHS, is not supportive of this. So of course she's not going to bring it to fiscal. So I'm sort of unclear why we're even having this conversation about fiscal when we already passed 444 that has a ton of ARPA dollars, because there's a ton of policy attached to it. This is the same boat, tons of policy and funded by ARPA. This is a policy decision that 1,800 people, almost 200 businesses are begging for. So absolutely, I think, you know, it may be disingenuous, but here's the thing. I think a vote against this bill is going to be a vote against our businesses, a vote against our families, and a vote against every single working woman who's had to leave the workforce.
I completely disagree.
All right, we'll wait for a week. Maybe the department can share the concept paper with Senator Whitley and Senator Sherman, Senator Gray, and Senator Avard. Okay? Okey dokey. All right, we'll come back to 450 in a moment. Let's go to 458, which is Senator Daniels' bill. And the most recent amendment is 1002. So there was a long hearing on this bill, a lot of discussion about where we were at in terms of timing, in terms of the services. There's a lot of discussion about the bill structure that would have allowed for out-of-state placement. There was a lot of opposition to that. Advocates for the bill came back and were willing to move the date back for closure of the Sununu Center to July 1 of 2023. I'm sorry, 2024. I'm looking for that date. Yep, it's on line 18 of page 1. I've sort of summarized it. Joe, do you want to add any flavor to some of the different services as opposed to out-of-state placement, the therapeutic nature of the services as opposed to incarceration? And then I'll get into a couple of other small changes that, one that Senator Daniels wanted to make, one that I wanted to make.
Thank you so much, Joe Ripsum, Director, DCYF. Good to see everybody this morning, and thank you, Senator Bradley, for considering this, bringing this forward, and for asking me to share a bit about it. I think the pieces of this bill that really focus on the therapeutic treatment and clinical changes come in, let's see, this is page number 2, starting line 3, Roman 4. And this really sets forth kind of the change in the program model to a clinically focused program model, changing staff qualifications, education, training, expertise, utilization of evidence-based models, and tying that back to the system of care legislation. So that, in that legislation a few years ago, we established a definition for what an evidence-based practice was and how do we qualify that and such. So this ties it back into the system of care work. Similar with C, starting on line 10, ties this back into the comprehensive assessments for treatment that we utilize, where there is a child adolescent needs and strengths tool and a psychosocial evaluation of every child who gets sent to SYSC so that a determination can be made if there's a clinical intervention that's more appropriate, and if so, they can be moved from SYSC to that clinical setting instead of within SYSC itself. D, starting on line 14, talks about the use of the care management services. That is also a new component of the system of care related to having a high-fidelity wraparound team work with all youth who are moderate to high-need behavioral health youth and all youth engaged in residential care. The residential care program really focuses on doing that discharge planning and making sure there's community resources in place for when a child returns back to the community. Having that type of support for youth at SYSC is hopefully going to be impactful on the recidivism rates that we tend to see there. And then, a couple other things in here just around really almost having an unlimited visitation opportunity with families. The idea is that youth who are there for a short period of time in almost all instances. If you want them to be successful in the community and in their families, you need to be doing family work with them. Lastly, I'm just going to jump ahead a little bit. In H, just making clear kind of the oversight provisions that the Office of the Child Advocate has and the access that the Office of Child Advocate has, specifically real-time access to the case management system. So if there's incidents, anytime there's any type of incident with the youth, that's entered immediately into the case management system. It notifies leadership in the facility, it notifies myself, notifies the OCA in real time, but also makes clear that they have access to video surveillance anytime they want, access to kids anytime they want. Their current practice is to go in there and do activities for kids on at least a monthly basis. So that's kind of the programming shift pieces. Happy to go into deeper if folks want to.
Thank you.
Senator Sherman.
Yeah, thank you, Director. Just a quick question. I know it's in here somewhere, but if you could point it out to me. One of the big concerns about the current facility has been the abuse, sort of the late night, nobody's watching kind of abuse. What are the safeguards against that are built into this structure?
So I don't know what's in the bill specifically around overnights. That really comes through what the staffing patterns are. But the staffing patterns for the facility for the last numbers of years have been quite different than they were in the past. With a reduced census and running typically 2 to 3 units at a time, we require there to be 2 youth counselors and 1 supervisor. 2 youth counselors for every floor that's operating and 1 supervisor. What that turns into typically is a ratio of about 3 youth per staff or less, 2 youth per staff. So you have a pretty high ratio of folks who are able to see what's happening, combined with the fact that you're running video surveillance, in every unit. The only places they don't get the video surveillance is inside the bedrooms themselves, with the exception of a handful that are video monitored because a child might be at suicide risk, and within the restrooms.
So to avoid this, in the many child care facilities have allowed anytime visitation. So you could walk in as a parent and say, I want to see my child, and they accommodate that. That way there's no issues of there being a period of time when really the child is not potentially protected by. Is there any role for that in this, or would that just be unworkable?
Well, I think, we anticipate open and regular visitation on a daily basis. I don't know that we'd anticipate, allowing a 3 a.m. visit just to disrupt operations unless there was a good reason for it. One of the big shifts there, though, has been that we now have a full-time psychologist working there, and that would be the plan moving forward as well. So a lot of things that used to be kind of set in stone in terms of, this child's at this level and they only get visits during this time, she has kind of changed the thinking around a lot of that and saying, no, this has to be individualized to that youth's needs and to that family's needs, and what accommodates that family's needs. So that's part of what's led to having pretty much visitation open, at least during waking hours and business hours at times that are convenient to the family and the young person.
Any further questions of Director? Okay. Let me walk through a couple of the changes that I asked for. On line 6 of the amendment, there had been a phrase in the southern portion of the state. I removed that so that we're not picking and choosing where it goes. And then I added the following sentence on line 7: the department shall consult with any prospective community about the location and operation of any 18-bed facility. Obviously, it goes without saying that the department would do that, but I want to make it crystal clear that no decisions have been made. There'll be all sorts of consultation with a host community. All right, I touched on the date, in line 18. Then, if you recall my hissy fit, on line 35 and 36, I added that the governor, with the approval of the fiscal committee, can delay the June 30th, 2024 project date if there are construction delays or other unforeseen circumstances. I'm sure that not everybody is going to be thrilled with this, but we backed ourselves into a corner with arbitrary deadlines that may not meet, in particular, construction schedules. And given the status of the world right now, it just seems to me to make more sense. Everybody is in agreement. You heard the governor say that he wants to bulldoze the existing facility. I don't think there's any disagreement about that, but let's not back ourselves into just the unrealistic out-of-state placements that were in the original part of the bill with a terrible date. Wait 1 minute. So in earlier versions of the bill, there was a sentence on page 3 of the bill: the department shall dispose of the property in a manner consistent with the express city interests and the interests of the state. It seems to me that the sentence that preceded that, the department shall consult with the city of Manchester prior to any sale of the property, is all-inclusive, and there's no need for redundancy, so that was struck. The last thing, as I recall, the appropriation originally in the bill was 11.5, and this is pretty quick inflation, but it's proposed at 15 million, and I would propose we let finance scrub that. All right, Senator Sherman.
First of all, I think this is great. Hugely supportive. One question on the delay. Should we have a phrase in there in line 36 that says project completion date up to blank number of years, rather than just leaving it open-ended? Would it be, if you gave a 2-year, I'm just nervous about leaving it open-ended. If you said, you know, construction delays, 2 years would give, that would be a huge delay.
All right, if that's what it takes for a compromise, I'll go with that, because there'd be obvious opportunity for the legislature to weigh in.
Right, and that's what I was thinking. 2 years would allow them to jump in, but if we just leave it open, we may see a forever delay.
Yep. So just
All right,
strike.
how about provided any such delay be no more than 2 years?
It's fine.
Mr. Chair?
And I just had a follow-up, if I could.
Yep.
This is not meant to be controversial. This is meant to be a question about process. We just got done with a bill where we said we were going to leave it up to fiscal. Now we've got another bill with an even larger appropriation using ARPA funds, and we're not leaving it up to fiscal. I just want to understand the difference for process understanding.
We passed in the budget of 2021 and the budget of 2019, closure of the Sununu Center with so it is state law that we're doing this. So that's why I think there is some difference between 446 and 458. And we didn't take action on 446, so it lives to be talked about on another day.
Okay, thank you.
Thanks, Mr. Chair. So I'm wondering if to Senator Sherman's point, on line 36, do we just want to strike, we could have it just say, for construction delay, period. We don't even need to see other unforeseen circumstances.
I put in unforeseen circumstances because we just don't know.
Right.
And arbitrary dates that, we're going to, if Senator Daniels in order to try to comply with the law, was sending kids out of state, which everybody was apoplectic about for good reason, here I go. You're starting me on my hissy fit.
Cool.
Okay? You like that?
I'll match it.
Okay. Well, you already have.
Oh, thanks.
Given the status of the world right now, I think unforeseen circumstances is not a bad idea.
Yeah, no, and I absolutely am sensitive to that. I'm also sensitive as a former advocate on the other side who's worked on this for a decade. It's like one thing after the other. So actually, on that note, do we want to hear from, I know Karen Rosenberg is here and has worked on this with do you want to provide some input, or is that okay?
Yep,
Thanks.
go ahead.
Good morning, Karen Rosenberg, Disability Rights Center. And right here, Karen Rosenberg with Disability Rights Center. This bill really is a huge improvement over the original bill. So thank you all for working so diligently with us on this and with yourselves. And as far as the deadline, you know that we're fine with that June 30th, 2024 deadline, but I do understand where you were headed, Senator Bradley, with this. Things can happen. Unforeseen circumstances, I think, is something that could, I'm okay with that, actually. I think that one thing that might help would be in the reporting section to just add that there be reports that indicate whether the progress that's being made is sufficient to meet the June 30th deadline, and if not, why not, and what efforts are being taken to address that. And
Where's that?
So that
Line
is
31, page 2, line 31.
Thank you, Senator Whitley.
Is that what you're referring to, though? Page 2,
Yes,
line 31?
Yes, exactly, line 31. So that might be a place to at least put in something about what's required in the reporting so that the committees would be able to assess whether the department's progress is adequate to meet the deadline and then ask any questions that are relevant at that point.
I think that's a great
All right,
suggestion.
so what if we were to say, submit quarterly progress reports on the implementation of this chapter or statute or?
So I've done a lot of special education work, and the way that special ed teams look at annual measurable goals is whether the progress that has been made is sufficient to meet the goal. So maybe that would be something that you could do, that you could import into this bill.
Right, because we're not creating a new statute, are we?
We're not creating a new statute, it's just the report would include whether the progress that the department has made towards completing the new facility is adequate to meet the June 30th, 2024 deadline, and if not, why not?
Did you get that, Cam? I know Attorney Rosenberg speaks
speak
very
so
quickly. All right, so maybe
All right,
just
how about
say a little
this? How
slowly,
about
yeah.
The Department of HHS shall submit quarterly reports to the Joint Legislative Committee on the progress of the goal to create a new facility, something like that.
Can I add? So whether, on the progress that the department has made and whether the progress is adequate to meet the June 30th, 2024 deadline. Did I slow
think-
down enough?
I think we're, going down the road and we're over the other side of the hill now. Really, what you want is that they, in the report, that they submit a progress report, which includes the estimated completion date of the, current estimated completion date of the project. I think you can do that in those few words and get what you want.
It's kind
Not
of
if you went
already
to
there,
law school,
isn't
but
it?
I think you're correct.
I mean, it's already there.
just
Quarterly
play a lawyer
progress
here in the
reports until such time as the facility is operational. I mean, I think it's already there. I'll tell you what, I'll take this bill out, and in my remarks, I'll make it clear that we expect that. Okay? Is everybody good with that? Okay. All right, so, yeah, Senator Avard moves ought to pass with the language at the end of line 37, provided any delay be no more than 2 years.
If we are doing a committee amendment, just on line 36 of page 2, project completion date under paragraph 2 for construction delay, should that be construction delays if we're already doing an amendment, or delay in construction, or construction delay just doesn't read right to me?
Because circumstances is plural.
Yep. All right, so add an S to delays. Provided any delays, it should be plural again, be no more than 2 years. All right. Senator Avard's moved the amendment. Seconded by Senator Sherman. Any further discussion? All in favor, say aye.
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 Any opposed? All right. Senator Sherman moves ought to pass as amended, seconded by Senator Avard. In favor, all in favor, say aye. Aye.
Aye.
Any opposed? We're not done yet. All right, it will not go on consent, I'll take this one out. All right, we have exec 1, 2, 3, 4, 5 bills. So the good news is, I think we can cancel tomorrow's session because there'll be none of these other bills ready for tomorrow. But I think I'll work with Cam on scheduling 2 or 3 hearings on House bills for next week, knowing that we're going to have another executive session. So there are a couple of more bills that we may be able to take care of. Let's go back to 372, which was my bill. Paula Minahan's not here. I know she's contacted all of you, because she has certainly contacted me, that even with the amendment that I proposed, well, I'll let others talk to what she said to me.
Remember what the name was, or the number was? Oh,
It was is it 3? Yeah,
377F?
377. So I would propose,
No, 372.
No,
Oh, you were talking about the amendment. Oh,
it's
377.
377, and I would propose just going with section 1 and 2.
May I?
Yeah.
So I think, your constituent raised, some significant issues, but I think that my understanding, and again, this was a new issue, that really that those issues, while significant, will not be addressed by this bill. And so, perhaps making sure that that constituent works directly with the Department of Insurance or whoever is the right contact within state government to get it resolved, I think that's the better course.
So nobody has seconded the amendment. So is there a subsequent motion?
Second.
How about interim study?
Interim study is fine.
All right, well, interim study, not compromise.
Go ahead.
Like you feel so agreeable.
I don't need to say
Senator Avard has moved interim study. Senator Sherman has seconded. All in favor, say aye.
Aye.
Any opposed? I'm opposed. Yeah, sorry. Consent. Senator Avard can take it out. No, it's 4-1.
Oh.
I voted opposed. All right. Senator Sherman, how are you doing on Senate Bill 450?
I'm good on it. So, Senate Bill, I'll just be, sorry. Full transparency on Senate Bill 450. This was one of two bills that were introduced coming out of the work we've done on the Prescription Drug Affordability Board. This is a board that passed unanimously through the Senate. It was endorsed, and actually the governor came down and spoke in favor of the board personally. When we started actually putting together the board, the great news is under Chairman Representative Merchant's leadership, we are well ahead of other boards across the country because there are multiple of these moving forward. But we also found, as we often do, especially in something this complex, that there were housekeeping items that we needed to fix, some of them fairly significant. We have spent many hours, probably close to 60 or 80 hours of work as a board. Senator Carson is on the board. She has been very supportive of this, and so the House bill was one set of housekeeping items. Our bill, my bill, was another set of housekeeping items, and at the same time, we took a request for funding to fiscal, initial funding just to get the process started, and then we also were at a point where we were moving forward with rulemaking. So it was sort of four fronts coming out of the board. The first one was going to fiscal, and that is now on the table because of some process issues, particularly Representative Leishman was concerned that we didn't have rules in place yet. So rules is moving forward. There were other concerns that Representative Leishman raised, but at the same time, the House bill was replaced with a possible repeal of the entire board in subcommittee. And then what the committee did was they decided to basically interim study it. So the amendment you have before you, 1018S, incorporates the housekeeping component that was that was put in interim study in the House, and it incorporates the concerns of, I believe, pharma, and the concerns of Representative Leishman. So walking through it, and it also has the original housekeeping components. So the first one you'll see where what we found was the manufacturer includes a packager, repackager, labeler, or relabeler. There was a concern that this would actually pick up FedEx. that was never the goal. What this does is there is a group of people who repackage and then set their price. And what the goal of the board is to understand pricing specifically as it relates to state funded prescription plans. So what we're trying to do with the board is be as smart as we can with our state dollars. That's really what we're trying to do when it comes to state funding of prescription plans. What this is not, it is not price controls, because that's illegal. That's interstate commerce, and we can't go down that road. This does not set prices. It does not penalize pharma for any prices they have. It is a nationwide process, state by state, of trying to understand why prescription drugs are so expensive, and how we can take advantage of available opportunities to lower the cost for the state. Some of the more mundane issues is that a member may be a legislator but is not required to be a legislator. That was put in because it turned out everybody who was appointed by the Speaker and by the President of the Senate turned out to be legislators. And that wasn't the intent of the bill. The intent of the bill was to have people from the state who were expert in this but did not have a conflict. In line 18, 2 alternate members, that's so that we can meet quorum requirements. It's a small board, it has 5 members, and so being able to have alternates appointed is really pretty critical, so that you can have enough members at any one time. So that's most of page 1. The original bill allowed the board to employ just an executive director, but nobody else, so you'll see that added on. Let's see, section E on page 2, it makes this the conflict of interest comply with other, uses the standard language rather than using new language. So it's just standardizing based on RSA 15B. A concern that was raised by NAMI was that some people would be prohibited from participating simply because their entire organization has a lobbyist on board. But that organization, if it does not directly benefit from the board or from the action taken by the board, the idea is that that person can still participate without a conflict. And that's pretty critical because we really want the most qualified people on the board, the most expert. Another was limitation of the fees. So there are fees because this is a self-sustaining board, but you'll see down in lines 29 and 30, this is addressing some of the concerns of pharma and also Representative Leishman, provided that the amount shall not exceed 15% of the board's annual operating costs. That means we just can't go out and ask for any fee amount. The fee has to be targeted to meet the operating costs of the board. And then the other concern was that there was no process for appeal of a fee, and that is brought in under lines 33 through 37. Finally, again, the other part of this that was not in the original bill was creating the non-lapsing fund to put these fees in, and that is the last page, the new paragraph, section 9. I think that covers all of it. What we tried to do was to address all the concerns. One of the things I found, I went and testified and answered questions in the House, was that a lot of people didn't really understand what the board was supposed to do or the powers of the board. And so what had been an effort to repeal it completely turned into an effort that said, well, it's fine for the board to go ahead, but we're not going to make any changes over here in the House at this time. And that's where the interim study came in. So I would ask that those changes, these are housekeeping. The Senate had fully supported the board in its implementation. We've seen actually a reverse auction has saved significant amount of money for the state. That was one of the three major, as you all will remember, three major thrusts of the prescription drug work that we did in the last biennium in a totally bipartisan way. So I would hope that we would support these changes, which really are needed to allow the board to move forward and continue their work in really trying to lower the cost of prescription drugs for the state.
Okay, thank you. So there was an issue that has been raised by some about conflicts of interest of members on the board. Right. What I'd like you to do is I asked Rick to take a look at, how to better define conflicts of interest. When you see this amendment, which I'm going to give to you, don't blanch because it struck out all of the other pieces of the bill. It was just intended to address conflicts of interest. What I would suggest is you and I work together, if you're in agreement with where he's going, to merge, the things that are in your amendment with the conflicts of interest piece here, okay?
Yes, as long as we can incorporate the other working parts.
Yeah.
Right.
Yeah.
So
that's what I mean. Don't blanch when you see that the rest of it was eliminated.
Okay, I got it. So can I just address the conflicts of interest? There have been people who approached me. I'm not chair of the board, but it does appear that there was one member who may have had a conflict, and that person is leaving the board. There is one more person who was appointed and ran into the lobbyist issue, although they have no direct impact. And that's why that was incorporated into this. But I've encouraged the chair to talk to the Attorney General's office. And the Attorney General's office does have someone who advises the board directly to make sure that that is not an unreconcilable conflict. So I'm fine with working with you and Rick on
and
this.
I do have, again, copies of this amendment. It is in an amendment form, but the intent is not to change any of the other issues that Senator Sherman has raised. So anybody that wants it, but I think I can pass it out.
This is going to be.
All right.
I think this is going to be fine. So.
Okay. So we'll hold on 450. All right, we have one more that we could take up if we choose to, which is 374. That was Senator French's conscientious objector vaccine bill. So I just had the bill folder out, looking at the testimony. The concern I have with this bill, and as anybody that recalled last year with Representative Lang's bill, how we tried to thread a needle, there are some pretty significant issues raised by the policy in this bill, none more so than what conscientious objector status would mean for receipt of Medicare and Medicaid funds. There's a bill in the House, I think it's 1604, that had, I believe, a price tag of well over $100 million of loss of funds. So I'm filibustering until Senator Gray gets back. If we want to take action on it today, we can. If if we want to wait on it, we can. My recommendation is going to be interim study.
As a co-sponsor, I would move ought to pass. And I echo Senator French's sentiments that our children are not for sale and people who are back. And so I'm going to side with Senator French on this one. So that's where I stand.
Senator Sherman.
I stand with the Senate. Oh.
So you were just.
Napoleon.
Overruled.
I will defer to the canine in the room.
He overruled you.
He's been pretty good, hasn't he? He's hungry.
In spite of Napoleon, right? Yeah, Napoleon's objections. There is no other FDA-approved vaccine that would have this designation or allowability. And the science, the clear, definitive, reproducible science shows that not only will this bill have an enormous fiscal impact, but people will be put in jeopardy of illness or their lives if this bill moves forward. I would be happy to move forward with an interim study or an ITL. I think on so many levels this is inappropriate. Again, it's telling the department that we in the legislature know better, which on this issue we don't. We have experts in the department like Dr. Chan, and we have deferred to them throughout the COVID pandemic. We have built an incredible public health network, and this bill seeks to dismantle it with zero scientific basis or clinical basis. And I have asked for peer-reviewed scientific articles that would actually support doing something like this. And I think this gets back to what is, to me, an unreconcilable difference of opinion between what is the role of individual freedom and individual responsibility. We as a society, whether it's polio, pertussis, measles, mumps, rubella, we have decided that as a society we have an obligation to each other and to our community, and this would tip the scale in the favor of, no, we don't. We don't. And so I would strongly oppose this, but I would be happy to go along with an interim study.
Anyone else? Senator Whitley?
Yeah, thanks, Mr. Chair. I certainly agree with everything Senator Sherman said. And, also sort of the notion of singling out this vaccine is so problematic to me. And I just don't think we should be in the business of letting politics and sort of national political rhetoric get in the way of what's best for the public health of our state and our children. So, I certainly think this deserves an ITL. Feeling agreeable, I'm happy to support an interim study. And then lastly, just the notion that this could result in such a huge loss of funding as identified by DHHS makes this an absolute non-starter for me.
So
Senator Avard?
I strongly disagree, and I do believe that, yes, there's plenty of science out there, but I believe it's political science at this point. And I do believe there are many people that dissent out there, and that their voices have been shut down. This is a matter of conscience, and I believe that I strongly stand in support of this bill as an ought to pass, and I'm going to leave it at that.
All right, so Senator Avard, I'm going to allow you to make the motion.
So moved.
Is there a second? Senator Avard's moved ought to pass.
I'll second it.
All right. Any further discussion? Seeing none, all in favor of ought
Aye.
to pass, say aye.
Aye.
And opposed?
No.
No. Okay. Is there a subsequent motion? Senator Sherman moves interim study. Is there any further discussion?
I think it's a very bad mistake. I think citing on the individual's conscience is it's the American way, and I do believe that this has been politicized to the point that in candidate Biden's own words, his own words, I do not trust the FDA or the CDC. In candidate Kamala Harris's own words, I do not trust the FDA and I do not trust the CDC. And the way he's handling things these days, I'm surprised that he trusts his own administration of what he's doing at this point. And I could hold up a bottle of baby powder. And I could say, who'd have thunk 35 years ago this little innocent little baby powder would have caused cervical cancer? But we didn't know. We don't know what the long-term effects of this COVID vaccination is. There's nothing that says that people can't get this COVID vaccination. But to discriminate against people who've chosen out of their conscience not to get it until maybe further studies come out, until this has been depoliticized, is a huge error. People have a right not to get this and not to be discriminated against one way or another. And people who are vaccinated can still spread this thing. And people who are not vaccinated can still spread this thing. Nobody's saying you can't get vaccinated. Nobody. And so nobody in this room could tell me what's the 5-year, what's the 10-year, what's the 15-year side effects to this bill. But I can tell you out on social media, there's a lot of people out there putting stuff out. Whether it's true or not, it's still out there. It's still out there. And their voices are being shut down. So I side with Senator French. I side with him wholeheartedly on this. And I will vote no on interim study.
Senator Sherman.
I am not going to go down the national politics rabbit hole. I think it's irresponsible. We're talking about people's lives here. We're talking about children who have died from COVID. We're talking about children who have long COVID. I have several constituents who are now being seen down in Boston because they had COVID prior to a vaccination, and they are suffering. Up to 10 to 30% of people who have COVID will have long-term impact of COVID. We don't let people conscientiously object to the idea of driving drunk. We don't let people, as a society, get behind the wheel of a car and drive drunk. They can drink, but they need to stay home and not drive. We, as a society, have said, that's harmful. That's not a good idea. We, as a society, have said that we watched children on an iron lung with polio. We as a society watch children come out with long-term crippling disease as a result of polio. We didn't wait 30 years when the polio vaccine was available. We jumped on it because we knew it would decrease disease. Of course, people with the vaccine can carry the virus. And of course, people with the vaccine can still get sick. That's true of any vaccine. Nobody, unfortunately, in some ways, has shut down all the misinformation out there on the internet. Nobody has. They're out there on the internet still, and a lot of them are making a lot of money off of that misinformation. But I will not stand for allowing them to hurt other people with that misinformation. And that's what happens when we allow people to avoid vaccination and then fully participate in the public school system or other systems, putting all of the children who can't be vaccinated for medical reasons at risk. That's why we have public health policy. It's vetted, It's clinically, you shake your head. My closest friend from med school is one of the top researchers on this at Vanderbilt. So you are saying that he's full of it, that he's lying, that he's making it up. I don't know where you're getting this, but the bottom line is this is solid clinical medicine, as solid as other vaccines. So you can shake your head. I'm a physician. I'm a doctor. This has been 30 years of work.
Not on COVID.
Okay, all right, let's,
And let me just finish. So there is clearly no resolution to this. But what I would ask is that we as a committee, as a legislature, follow the science, follow the best science, and protect children from COVID, from long COVID, and from potentially death, especially those who can't be vaccinated for medical reasons. Thank you.
And Senator,
quick response.
I believe that I've heard that there are children that are dying from the vaccine. And, okay, so now you're shaking your head.
I'll get you the data.
Yeah, and I'll get you the data.
Okay,
And see, that's the problem. And it's been over politicized. It's been over politicized. And this is a right of conscience. This is a right of conscience. And that's what we're trying to protect with this bill.
You're going to let him have the last word.
Yes, why
No,
not?
I'm going
Yeah.
to get the last word.
Oh, can I just say one more thing before you have the last word? Yeah, I just also feel like we as elected officials, like we have an obligation not to be scientists. I'm not a doctor, but we have an obligation not to spread misinformation. So I really want to caution us from, of course we need to respond and listen to our constituents, but it's very, very dangerous for us as elected officials to spread misinformation that's not based on science or fact.
Okay, so you have a visitor.
My emotional support animal.
All right, so I'm going to vote for interim study, all right? There was no more contentious issue last year than vaccine policy and the eventual passage of House Bill 220. I recall that it was a highly fought over bill. I know that you didn't support it. I don't think you supported it, Senator Whitley. But it did try to strike some sort of a middle ground. We didn't say that healthcare facilities could not mandate vaccines. We didn't say that. We allowed those facilities to determine their own policy, as well as businesses. That was what we supported last year. The governor signed it. Subsequent to that, there were federal mandates for healthcare workers that were upheld. Whether we like it or not, they were upheld in the Supreme Court. So, to me, Senator Sherman, Senator Whitley, and Senator Avard are all right about some things. But the one thing that I can say for certain is that we're putting at risk Medicaid dollars, and that concerns me significantly. And for that reason, I think, and for the reason that we tried to thread the needle last year, and this goes way beyond what House Bill 220 did last year, I'm going to vote for interim study. Sorry, Senator Avard. That's the process. Okay? All right.
Napoleon's a good consolation.
Yeah, well, he's got a consolation prize. Is there any, Senator Gray, you want to add anything?
No, sir.
All right. All right, so the motion has been made by Senator Sherman, seconded by Senator Whitley for interim study. All in favor, say aye.
Aye.
And opposed? No. All right, so it's 3-2. I get the honors on this one.
Sure you don't want me to do it?
All right, let's, before we quit, do just a quick review. All right, so 287, hopefully we'll have a resolution by next week. 288, see if I can thread that needle. 332, we will have a resolution by next week. 416, we'll have a resolution by next week. 446, we'll have a resolution by next week. 450, hopefully we'll have a resolution by next week. So my count is we still have 6 bills, and my count is we did 3, 4, 5, 6, 7. So the, we have to get out 446 and 416. And I would argue that we have to get out 332. Even though it has no FN, it has the largest FN that we have. Okay, Senator Avard has moved that we come out of exec session, seconded by Senator Sherman. All in favor, say aye. Aye, we're adjourned. Thank you. I don't know.
You sent some energy that you needed some love. Sweet pup there. How old is that pup? How old is Napoleon, Jeff?
He's 11, I think. Yeah, although small dogs like that can live to 15 to 18, yeah.
So,
All right, so you need to look at that, see, fit it in.
or incorporated into this one?
Yes, yes.
You okay with the other stuff in this one?
Yeah, I don't see any, nobody's objected on it. I'll take him out. I'm just about ready. Thank you all for putting up with Napoleon.
Napoleon was wonderful. You were wonderful. Maya would shed. Napoleon has that.
No, he doesn't.
No, he
That's
doesn't.
the beautiful thing. He does not
What's
shed.
your mix of? Poodle and what, Jim?
Poodle, mini. Let's have a 2-second conversation upstairs, okay? Yes.
You had mentioned that you had extra copies of your amendment to 450. Was that
Yes.
for these folks?
Yes. Hang on. Let me, it's hard to organize my papers and a dog. Okay. Reach out to the department, get their proposal on 450.
Last night I talked
Hold on a second.
I don't know why she needed to, so. That's why I said it here, so